views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually throughout the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, November 17th. Coming up, Bronx Community Health Network joins us to discuss Thoughtful Spaces, their new mental health initiative. Then we'll learn about childhood obesity and its relationship to COVID-19 and how Fan4Kids has been addressing and combating childhood obesity in the Bronx. After that, the Knowledge House provides young workers with opportunities in tech careers by offering free tech training here in our borough. We'll tell you all about their programs later on. And South Bronx Mutual Aid has continued to provide much needed resources and information to neighborhoods and families throughout the pandemic. So please stick around. Open BXRX starts now. Welcome to Open BXRX on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Since 1996, Bronx Community Health Network has assured access to quality, affordable medical, behavioral, and oral health and related services here in our borough. BCHN has a new mental health initiative called Thoughtful Spaces. Here to share more about this initiative and more is Lechelle, social worker, and Joanna Ocasio-Janvier, patient educator at Bronx Community Health Network. Thank you so much, ladies, for being with us today.
No problem. Thanks for having us.
So first, I gave a little intro, but for anyone who may not be familiar, can you share a little bit more about a Bronx Community Health Network and your mission?
So BCHN is pretty much a nonprofit organization. We've been around for about 24 years. Our mission is to ensure access to quality, affordable health care, regardless of your race, socioeconomic, or citizenship status. We have about 21 community and school-based health centers in our network and around the Bronx, and they serve about 114,000 patients a year. We're also extremely proud of our community health and wellness programs made up of our patient navigators, community health workers, and emergency room liaisons and health educators who actually reflect a wonderful Bronx diversity. And that team is a crucial link to integrating the healthcare, clinical care network and important community social support services, such as our food pantries and SNAP for food stamps, housing, health insurance, jobs, and education that are necessary to complete wellness and optimum living for us, our Bronx residents.
Thank you, Lechelle, for sharing. And, we know that these resources are important and have been important to the community for many years, but how has BCHN helped provide resources and services to Bronxites throughout the COVID-19 pandemic in particular?
So our community health and wellness team continued to provide our social support services during the pandemic. And we celebrated the launch of our new outreach van in late February, but then pandemic hit, we were all locked down. But we miraculously were able to find ways to utilize the van during COVID and launch like a new food delivery initiative in May. And we also partnered with Montefiore Project Bravo Food Pantry. And now we deliver food from the pantry to families in need all around the Bronx.
That is amazing. Thank you. And let's get right into it and talk about your new mental health initiative. It's called Thoughtful Spaces for anyone tuning in right now. As we know, mental health is just as important as physical health, and isolation and loneliness during the pandemic may present specific mental health risk for many people. Can you tell us a little bit about how you're providing help through this new initiative?
So during these turbulent times where people's access to services are extremely limited, Thoughtful Spaces provides a new forum for outreach during using social media and the internet. And our initiative not only shows those in need that they're not alone in the struggle, but there's still an avenue towards health, stability, and recovery.
And who qualifies to get this help? How can they get it through BCHN?
Anyone can pretty much qualify. We don't really discriminate against anyone getting the services. We say you can email us at thoughtful-spaces@bchnhealth.org. And you could also give us a call at our hotline number, which is 929-220-8181. And that will give you access to someone who can help you get connection to any mental health services that you need, and even to a physician who can also assist as well.
Right, like Lechelle mentioned, it's a nonprofit organization, so we offer services for everyone. No one ever gets turned away. In fact, we try to, reach out to them as best as we can through the help of the van now during COVID-19 and giving food out. Like I mentioned, I'm a patient educator, so I work in conjunction with BCHN, but I don't work for BCHN. I actually work for Montefiore Medical Center. And so I work collaboratively with them and referring them to patients that need food, housing, legal, and all those avenues. I give them the referrals. But as far as my role, I work, in conjunction with Lechelle and other social workers in providing behavioral health triaging at the centers.
Right. Thank you, Joanna. And can you also help us discuss the stigma behind just talking about mental health in our homes, and the stigma that maybe the patients that you speak to and work with directly feel and face when it comes to talking about mental health? How can we start getting past the stigma and prepare to have healthy, constructive conversations with one another about mental health?
I think a way to start it is to have it be understood that mental illness is a disease that is treatable. And it's also not something that happens to a specific group of people. It can happen to anybody. Any situation can occur that can cause someone to really feel like they can't function with daily life. Everybody has their moments when they get depressed or they get anxious, but at a certain point is when it starts to enable a person to just do normal things. That shows that anything can occur where you might need that extra help. And I feel providing education, being open-minded, and providing compassion are ways to promote a healthy, positive conversation about mental health. And that's, again, what Thoughtful Space is also a platform for. It can help someone that may need assistance in coping with a bad day to someone who may be struggling with thoughts and emotions and feelings over a long period of time. And that's why we, again, want to bring that out there to provide that and begin that conversation and be constructive about it.
Yeah, we've been, I know in Montefiore, we've been doing collaborative care, which is the whole team, trying to really emphasize how medical health and mental health actually coincide with one another. Because if you're physically not feeling well due to diabetes or or heart disease, you always get impacted by depression or anxiety because you're worrying or you're thinking you're gonna die. So we really work collaboratively, and that's how we've been doing this for over 5 years already through the medical groups, and with the help of BCHN, who offer all these wonderful services for our patients. We just really try to make the push to really give as much help to the patients out there for mental health. Absolutely. So this is just another avenue through the social media platform. We know we have a lot of young people who are struggling, not just all age groups from the pandemic. So we want to make it more accessible to the Bronx, especially.
Absolutely. I love it. And, just spreading the message that people are not alone throughout this, and using social media is an excellent way to, spread this message across and send that information and education to so many people who are already consuming social media, but, need an alternative or something else to escape just the convulsions of life right now. There's a lot going on, especially after elections finish and all these things and COVID-19, there's a lot going on. So just know you're not alone, and BCHN is here for you with Thoughtful Spaces. We're here talking about their new mental health initiative. So just to continue with our discussion, ladies, can we also talk about using mental health screening tools at home? I saw that BCHN shared a post with the following mental health screening tool on Twitter. We put the link right here below. It's screening.mhanational.org. Can you please share with our viewers and invite people to get screened online, but also follow up with a visit with a doctor in person as well?
Yeah, so I feel that those screening tools from MHS National, it's a great insight for a person to inquire about possible symptoms that they may be experiencing. But I feel like it's strongly encouraged to seek professional help from a mental health professional. They are the ones who can really decipher what exactly may be going on with a person. Because those screening tools, they're really great, but they can easily, for someone who's not trained to use them, can be misinterpreted in a sense sometimes. And just following up with a mental health professional is a great next step to just get and seek that help that you do need.
And let's talk also about the importance of not neglecting your health during these hard times, and also seeing a specialist, whether it be for mental or physical health, through the pandemic.
I mean, it's usually highly recommended for anybody to see our primary care physicians annually, just so we can ensure that we are all in optimum health. And getting access to care is even easier now, during the pandemic, because we had to, accommodate with these changes. For now, we use telemedicine. So now I know with that, PCPs are also incorporating mental health in their visits as well by asking a brief 2 questions in regards to depression symptoms. And usually if it's scored positively, they usually connect patients to mental health professionals who also do telemedicine as well. So if for some reason you are concerned, like you don't want to be outside, you don't want to be exposed too much, at least you have that access via telephone, via video chat, to get contact with both your PCP and also a therapist or a psychiatrist.
And having said that, they could also again contact the number that Lechelle gave for BCHN. BCHN, the community health workers, will outreach patients who are looking for a new primary care doctor because they don't have one. They don't reject any of the sites. We provide care to anyone who walks in. And so we are, the BCHN sites, the specific sites, they are federally qualified program. So you can pay as little as $0. As long as you need care, we provide care at the centers.
Right. Let's absolutely emphasize that, if somebody's tuning in right now and they're financially insecure, not sure if they can afford these services, can we just emphasize that BCHN also provides affordable healthcare to anyone who needs it, especially
Absolutely.
right now.
Affordable healthcare, affordable medications at certain sites. So it's strongly encouraged there should not be anyone without having medical care or mental health care.
Lechelle, before we go, thank you both again for joining us. Before we go, can we just provide our viewers with that number to contact and also the email once more, just so we can have it on screen?
So you can reach us by giving us a call at 929-220-8181. You could also email us at thoughtful-spaces@bchnhealth.org. And please also look at our upcoming social media at BCHN Health. We're having our hashtag Thoughtful Spaces, and we will provide a whole lot of information in regards to mental health needs and psycho ed, okay?
Perfect. Thank you so much, Lechelle and Joanna, for your time today and for discussing.
Thank you.
Of course. Again, folks, please remember to take care of your mental health as much as your physical health always. To find out more about the Bronx Community Health Network's new mental health initiative, Thoughtful Spaces, and other services and initiatives at the BCHN network, please visit bchnhealth.org and follow their social media at BCHN Health on Instagram and Twitter, and Bronx Community Health Network on Facebook. We'll be right back. Welcome back. Fan4Kids has been addressing and helping eradicate childhood obesity with a focus in the Bronx through fitness, nutrition, advocacy, and empowerment curriculum in New York City public elementary schools since 2004. Here to share more about Fan4Kids and discuss the relationship between COVID-19 and obesity-related diseases are Robert L. Oliver Jr., founder of Fan4Kids, and James Stratford, managing director. Welcome. Thank you so much for joining us today, gentlemen.
Thank you for having us.
I gave a brief introduction, but just for anyone tuning in, can you just tell us a little bit more about Fan4Kids and your mission?
Sure. I'll take that one, James. So our mission is simple. It's to educate kids and families about healthy eating and active lifestyles, but really to empower them to make better decisions regarding fitness and nutrition. Very brief background is back in 2014, I was in between jobs and coaching co-ed soccer and realized child obesity was a national epidemic. Knew something had to be done and had to be done in schools during the school day. And there was nothing out there that was geared toward weekly teaching covering both fitness and nutrition. Solutions were more marketing and short-term programming. And really a successful program required hands-on teaching and consistency over the years.
Thank you, Robert. Pardon me, I said 2004. Is it 2014, the founding year?
2004, that was my mistake.
Okay, gotcha. No problem. Thank you. So as we know, experts shared that during COVID-19, stress eating, inequities, lack of fitness, and more expect to boost obesity in our communities. Can you tell us more about this trend and what the risks are for our children in particular?
Yes, I'll take that one, Rob. How are you? Thanks for having us again. And being a native of the Bronx, I understand firsthand how important it is to have access to healthy eating, nutrition, and fitness. And growing up in the Bronx myself, I recognized that I was a part of public funded after school program that enabled me to stay active and involved. However, with the threat of COVID-19, our students and our families, particularly those in the Bronx and in impoverished and low and at-risk communities, no longer have that access. Again, I'm homeschooling. I'm a parent myself. I homeschool my child, and Rob and I actually had a conversation earlier today to talk about trying to social distance between the refrigerator and ourselves. We know right now with limited access to exercise, I'm not really being, I'm sure how safe it is to be outside right now, how restricted that can be, and also how much more important our mission is right now to give students and families access to healthy eating options, fitness, nutrition, exercises, because those things have been limited since COVID-19. So kids are bored, they're at home, they're in front of the television, they're not as active as they once were. Case in point, the sale of bikes have increased tremendously. I tried to find a bike for my son a few months ago, and it was hard to do so because people are looking for ways to get active. And that's where Fan4Kids come in. We're trying to teach families and students how to stay active and fit in the home, despite some of these challenges with COVID-19, because right now the threat is more real than ever.
Thank you, James. And that's so true. Roller skates also have been selling out like crazy.
That part.
But I wanted to elaborate more on childhood obesity here in the Bronx. Thank you for sharing that you're also from the Bronx. Let's discuss childhood obesity here in our borough. We know that many factors contribute to childhood obesity here, like the lack of access to healthy foods and how far healthy options can be geographically. Can you please share more about what may cause these numbers to continue to rise in the Bronx?
I think it's something worth calling out in terms of something that's been hidden in plain sight. And being from the Bronx, and I know firsthand that it's the lowest, the poorest congressional district in the United States. We're limited to access to healthy food options. I can actually, do you know a Whole Foods or a Trader Joe's in the Bronx or any other farmers market that our more affluent communities have access to? That's not a case. So it's not cultural. It's not something that's familiar. And what Fan4Kids does, we demystify that. When we were in schools, we had options for students and families to partake in healthy eating options during the school day, in-class instruction. And we kind of built that muscle within students and families to help them understand the importance of introducing our cohort and our clients the importance of healthy eating options. I remember growing up, literally, I'm Black, I'm African American, and I used to hate eating vegetables. But I remember the cartoon Popeye. I see how strong Popeye was when it came to spinach, and Fan4Kids is the same thing in terms of introducing new ideas to students and telling them that it's okay not to like something, but at least you don't like it until you try it. So we're trying to just increase the access that families have to these opportunities, increase their awareness, and then also include fun ways to include that in their everyday eating habits, diets, and lives.
Wonderful. Thank you, James.
Things I wanted just to add to that. It really is about belief. That the Bronx has been on this the 62nd unhealthiest out of 62 counties in the state of New York, and really is, do we believe we can make this change? And our organization has taken a ground up approach to excite the kids, to excite the parents, and really is, it really is, do we believe we can change that? And our results have proven that our parents and our constituents have dispelled the myth. And we do believe we can change that.
Right. And that was following up on my next question, kind of on the same topic, just on the importance of helping children understand nutrition from a young age. And how does Fan4Kids make this information accessible to even little ones who may not, be engaging in these conversations from young?
So, what we do, the way our program is structured is we have instructors that go into the schools and teach a year-long fitness and nutrition program. So if we are in one of the schools, we're in about 13 schools in the Bronx, a child gets Fan4Kids 50-minute class once a week for the entire school year. So they get 1 week of nutrition, 1 week of fitness for the entire 32 weeks of the school year. So it's ingrained, it's hands-on. When we were in school, we were doing food tastings with the kids, their favorite part of the class. And so we're a presence in the school, a presence in the community, a presence with the staff. Staff change their habits. Salad bars are popping up. So we are the hands-on fitness and nutrition program in the schools. And then, of course, we have other things that we engage the bodegas to try to supply healthy foods. We engage parents. And one thing I know, we'll get to a bit later, but one thing is with COVID, the technology of providing more parent workshops became easier. So we actually, during the school year, we're able to engage face-to-face with parents more frequently. So really is, as I said, it's the bottom-up approach of getting kids excited. We teach as young as 3 years old. We teach pre-K to the 4th grade. So we get them while they're young and formidable, and really kind of make sure those habits start off at the right place.
And something to add really quick, Sonyi, before you keep going. I've been doing youth practitioner work since I was little. I'm a product of it. You know what I'm saying? And as early as I can remember, my professional career in youth services date back to summer youth when I was 14, working in the Bronx. And something that is profound when visiting a Fan4Kids program is how astute these students are when it comes to these healthy options. There's competitions with healthy eating. They have a point system to where they count the amount of vegetables they eat. They're in healthy competitions in terms of trying new things, and literally it's led by the kids. And what happens is they go home and they share these things with their parents and their families, and they want to become involved. And then also too, our tagline is teaching lessons that last a lifetime. We have data that shows that this works. And even some of our advocates are former participants who are now young adults and adults who picked up healthy eating options and habits from childhood. So it's something that works. And I know firsthand with with my work in youth services, Fan4Kids definitely sets the bar when it comes to this work. And it's unique because no other program is doing this inside of the school the way we do.
It sounds amazing and really engaging for our youth. I wanted to know, as we know, public schools are working with remote learning and blended learning. How has your work with Fan4Kids shifted to provide education and resources to schools virtually?
So it was amazing. I'm so proud. Never been more proud of the staff that we had. I kid you not. School shut down March 13th, and a week later, we were prepared to continue teaching via Zoom, via Google Docs, via whatever technology is available. Literally that next week. So we started doing live classes when schools were prepared for us. We created a YouTube channel. We created probably 100 videos of fitness workouts, of nutrition tips. So it went all hands on deck, and we threw everything up against the wall, see what stuck, and they couldn't get enough of it. Really, it was a great resource. It's an easier resource. We continue to teach. We teach 3,000 kids a week. We continue to teach those same 3,000 kids each and every week. The problem was getting them in front of the computer and have access to the technology and Wi-Fi, which was a major problem. But we were prepared and are prepared, and just started to roll out again this year of teaching the same amount of kids, just slightly different in this Zoom era.
Absolutely. And before we continue, if there's a parent tuning in that needs help with rectifying eating habits at home and helping their children stay away from unhealthy choices, especially during these tough times, how can parents begin to do that with their child at home?
First and foremost, we have to provide access to healthy eating options for parents and also shift the culture within the home to help parents understand that there are easy and fun ways to make these things accessible by changing simple habits, by cutting up snacks and fruits and vegetables, keeping them available, making fruits available in the freezer, making healthy smoothies and drinks. Something that we do with the program is literally like through our Rotary supports, we're doing like online cooking classes. We have healthy eating options, even recipes for families that can make it fun. Again, I mentioned smoothies, cutting up veggies, keeping these things accessible, and at also eye level and reachable level for students and kids. So when they're in the refrigerator or they're in the pantry or cabinet or cupboards, they're able to see the snacks at the eye level. That also helps with things that they're eating. More importantly, taking time away from, like, we know that we shifted to virtual learning, but making sure you're taking some time to get outside, to get some air, you're staying active, and also too, using the resources you have around you. Right now, Instagram and TikTok is full of dance challenges, full of like healthy and exciting things to keep families engaged. And a lot of things that we're seeing is now parents are getting involved with some of those challenges. So we want to encourage parents to stay active, be involved with your children, and also get away from the computer when you can to get some air and stay active. But more importantly, making sure that these snacks are accessible, they're friendly, they're fun, and it's something that's interesting, that's incorporated into your household, so it's adapted by the children and the family.
That's a great point. It really is about doing what excites you. Not necessarily if we teach a lesson and that doesn't excite you, find out what does excite you. We have plenty of resources, but if we can't provide a resource, find out, there are plenty of things out there that whatever excites you, whether you're dancing in front of your TV, our fitness classes are available. But you could, if you don't like something that, a step class, so to speak, or, whatever it might be that excites you to do. And the other thing is really, really important these days, where it is advocacy, empowerment. Reach out to your local officials. Demand that we have better access to healthy, accessible, and affordable fruits, vegetables. So we can't stress enough. We're actually teaching that in our curriculum this year of advocacy work. And really from the bottom up approach is demand healthier, a healthier community.
Awesome tips. Thank you, Robert and James. Before we go, if there's an educator tuning in or a parent who's interested in working with Fan4Kids, how can they get in touch with you and support you as well?
Our social media handles, you can follow us on Twitter at Fan4Kids1. Our website is www.fan4kids, that's FAN4KIDS.org. Our Instagram is Fan4Kids, same spelling, YouTube channel Fan4Kids. And right now we're doing ongoing fundraising at CrowdRise, and the same thing as Fan4Kids. We want to encourage everyone to get involved. This is something, again, like we're teaching lessons that last a lifetime. Healthier children, we know in our experience, make healthier adults. And also, again, it's about time that we expand the work that we're doing to incorporate it in our mission and vision. And thank you for having us.
Thank you both again for joining us and sharing more about your important program with Fan4Kids. Thank you again.
Thanks.
Thank you.
Again, folks, whether you're a parent or an educator seeking more information, please visit fan4kids.org and follow their social media to stay connected at Fan4Kids on Instagram and Facebook and Fan4Kids1 on Twitter. We'll be right back.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from Bronx, this is Trans.
Welcome back. The Knowledge House offers tech training through free courses in coding, software development, data science, design, and more. Headquartered in the Bronx, the Knowledge House is on a mission to ensure that young workers are employed through COVID-19 and beyond. Joining us now to discuss is Jerelyn Rodriguez. She is the co-founder and CEO of the Knowledge House. Welcome, Jerelyn. Thank you so much for joining us today.
Thanks for having me today.
You're no stranger to the show. You've been on Open BXRx before with other hosts like Darren Hemick. But we want to give our viewers an introduction just in case they're tuning in today and they're not sure about your mission. Can you just tell us a little bit about the Knowledge House?
Absolutely. So the Knowledge House is a nonprofit based in the South Bronx, and we provide technology education programs to youth and young adults. Our mission is to empower and sustain a talent pipeline of technologists coming from low-income communities.
Wonderful. Thank you, Jerelyn. And let's discuss the Bronx. You're a Bronx native, born and raised, right? Yep. So how did you get into this field of tech, and why is it important for you to do this type of work here personally in the Bronx?
Yeah. So as we've all experienced being from the Bronx, I had to hear so many stories about the Bronx having a bad reputation, and so as I was heading off to college and into my first career job, I was always interested in figuring out how I can give back to the Bronx. I come from an education background. And so after college, I worked for 6 years in education before I started the Knowledge House. And being in education was a little frustrating because at the time I felt like the education leaders were pushing like a college or bust myth. So college worked for me, but it didn't work for a lot of my neighbors and family members coming from the Bronx. Right. So alternative pathways just became interesting and it became urgent, right? We have to figure out how to increase economic mobility and provide access to everyone, not only a few. And so I know that we had to look at alternative workforce development solutions. And that's how my idea for the Knowledge House came about. 6 years ago, government agencies were really paying attention to the growing tech sector, right? The Department of Education launched Computer Science for All. The mayor's office launched the Tech Talent Pipeline initiative. But really early on, these initiatives were not reaching Bronx residents. So it was important for my co-founder and I to start something that's homegrown and that provides Bronxites with access to high-paying jobs and high technical skills, because these opportunities are the ones that lead to economic mobility and uplifting ourselves out of poverty.
Absolutely. Thank you so much for sharing, Jerelyn. And one of the first things that I see when visiting the Knowledge House website is the quote on the unemployment rate in the Bronx. It's risen to 25%, affecting young people the most. This is what the quote says online, and it's true. How has the Knowledge House seek to diversify tech by helping young workers in the Bronx combat these high unemployment rates in our borough?
Yeah, so ever since the pandemic, the Bronx unemployment has risen, right? So 25% unemployment supposedly brings us back to the Great Depression era. And it's really important for us to pay attention to because young people are always impacted the worst. We provide code and design skills training to young people because we see that young people in the Bronx are innovative, they're creative, and so they should be empowered to produce technology, not only consume it. Like young people spend all of their hours on social media playing video games. Why not empower them to create these video games, to design these social media apps? And so that's what we're trying to do. We think that code and design skills are growing even through the pandemic. A lot of our graduates since COVID, they've just been working remotely. They haven't lost their jobs. And so we're preparing young people for the future of work, right? And to survive through COVID, post the pandemic. And digital skills training is just more important than ever before.
Absolutely. And it's something that, the Knowledge House is inclusive when it comes to training programs, right? This is for everybody, for anyone, really, any young person that wants to learn coding. You don't have to have like a background in this at all, do you, Jerelyn?
So our programs are tuition free. They are available to any applicant that considers themselves low income. And for us, you have to have a household income of $50,000 or less.
And no prior experience in tech at all. Like you can come in bright-eyed and ready to learn everything from the Knowledge House, right?
So our job training programs start off with the foundations. So we take in beginners. There is no experience required at all.
Wonderful news. You hear that? If you're interested, folks, please reach out to the Knowledge House. You can go on their website at theknowledgehouse.org, follow them on social media at the Knowledge House, and, you know, inquire about any of these programs that we're about to talk about now. Before we continue though, Jerelyn, let's talk about the ever-increasing tech demand. You brought it up in the beginning, and the impact of tech education in low-income Black and Brown communities, especially during this pandemic. Has Knowledge House seen an increase in interest in the programs that you offer ever since the start of the pandemic?
Yeah, so at the start of the pandemic, we saw our applications double, and we just understood, okay, it's not in our best interest to slow down because of the pandemic. There's more need. We just need to build capacity and be of service to our community members. And so not only did we see more applicants to our job training programs, but we saw our neighbors, other community-based organizations, reach out to us to learn best practices when it comes to virtual learning. You know, like, we're grateful that our staff and our students, since they're tech savvy, we had an easier time transitioning from in-person to completely virtual. But now we can offer best practices to other people in need, and we can serve more job seekers. And not only did we see this interest from the community, but obviously with the murder of George Floyd this summer, a bunch of companies also got interested in investing in racial equity work. And so we've now had more employers reach out to us because they're interested in hiring interns. We've reached out to corporations that want their employees to do more volunteering, you know, and so we are getting an increase of interest and support from a variety of stakeholders, which is great.
Tech is where it's at. Can you tell us about your Innovations Fellowship and the different tracks that participants can pursue when going through this program?
So this year, we are running 2 programs. We have a high school program called the Kareem Carbuch Coding Fellowship. And those high school students learn graphic design, web design, and front-end coding. And then for adult job seekers, we have the Innovation Fellowship. The Innovation Fellowship offers 2 tracks. So job seekers can specialize in full stack JavaScript or data science learning Python. Next year, we will be adding a cybersecurity track and a usability testing track. So we'll have 4 training options for adults.
Can people apply for these programs starting now for next year?
Yeah. So our application is live on our website. You can go ahead and fill it out. For now, you will be waitlisted. And then once we start our admissions process in February of next year, you'll be reached out to proceed with interviews, assessments, etc.
Got you. Thank you, Jerelyn. And for the high schoolers, Kareem Carbuch, aka French Montana. So that makes the program even cooler. You know, French Montana's from the Bronx, and he's repping on here, and that's who the program is named after. Really cool. What types of jobs can participants potentially land upon graduation, Jerelyn? What have you seen come up after people receive the certifications?
Yeah. So what's exciting about tech roles is that these jobs are in every sector. And you can pursue multiple tech occupations, right? You don't have to be a mathematician, engineer expert to go into tech. So a lot of our graduates land jobs at startups that are small, and then Fortune 100 companies that are massive. And they are securing roles as front-end engineers, computer programmers, software developers, software engineers, product managers. We also have students that go into sales and business analyst roles at tech companies. So I think the sky is limitless. These opportunities are out there for anyone to pursue, as long as you have the passion, resiliency, and grit to learn.
Awesome. Thank you, Jerelyn. Before we go, can you just provide more information on how folks can apply again? And also, how can people support the Knowledge House and stay in touch with you?
Yeah, so if you go to our website, www.theknowledgehouse.org, you can apply by going to the program section. learning about the Innovation Fellowship and clicking the apply button. And anyone can donate to the organization or sign up to volunteer. There's a get involved section if you want to learn how you can support. And if you click on our donate button, it will take you straight to the donation link where we will be accepting donations.
Thank you again, Jerelyn, for your time today. Jerelyn Rodriguez is the co-founder and CEO of the Knowledge House, and she's also a Bronxite, so representing out here and, you know, putting on for the borough. Thank you so much for all the work you're doing.
Thank you all for having me again. Always love BronxNet.
Yes, you're always welcome here. Folks, again, to view the programs at the Knowledge House, qualifications, and more information, you can visit theknowledgehouse.org. You can also follow them on social media at The Knowledge House on Instagram, The Knowledge HOU on Twitter, and The Knowledge House Fellowship on Facebook. We'll be right back. Welcome back. Throughout the pandemic, community members and groups have banded together to bring much needed resources and relief to neighbors in need. One of those groups is South Bronx Mutual Aid, founded by educators and volunteers serving the South Bronx. Joining us now to discuss is Ariadna Phillips of South Bronx Mutual Aid. Welcome, Ariadna. Thank you so much for making the time to join us today.
Thanks for having me.
Of course. So I gave a little brief intro, but could you tell us a little bit more about your mission and about South Bronx Mutual Aid, how it was founded and all that good stuff?
Sure. So for background, I'm an educator. I'm a bilingual educator in the South Bronx, and I've been the director of a dual language program for several years. And so one of the things I've seen just over time with a lot of the community that I've served is that we have a significant immigrant population in our community, and especially depending on documentation status of families, it can be really challenging just to have certain needs being met in normal times, non-pandemic times, right? So historically, we've tried to do at the school level and the community-based organization level, make sure that we're bridging those gaps for our families. One of the things we really started to notice during the pandemic, right, we had a huge loss of income for so many families. Families were absolutely devastated by the pandemic, and given a number of issues, right, access to healthcare, access to insurance, access to income and resources, we noticed that in particular, our community was very hard hit by the pandemic, and there was a lack of access to absolute necessities, right? Let's start with food, let's start with PPE, let's start with things that every family needs to have. And so I was hearing from it in students in my class. I've also taught in other schools in the community. So, I used to be a dean at a different school in the community. And so I was hearing outreach from former students of mine, current students of mine, parents, friends, and family of folks that I knew in the community. And so I had other friends that in other parts of the city had either taken lead or been very active organizers of mutual aids. So there were two other women that I, already happened to be friends with. One of them started a mutual aid in the Eastern Bronx. One of them was a critical member of Bushwick Ayuda Mutua, which is a Bushwick mutual aid group. And so I was following along in listening to what they were doing, what they were organizing. I have a bit of a background in community organizing. And so as I followed along with the progress that they were making in their groups, I thought, well, we absolutely need more of this here. And I knew that this was something that when I think about histories that I'm aware of as an educator, thinking about histories of community organizing, thinking about autonomous communities, indigenous communities in Latin America, and movements in the United States that looked at sometimes where there's a critical lack of infrastructure, particularly in the Bronx, right? We have a history of the Young Lords, we have a history of the Panthers creating mutual aid groups to help assist with food access. There's a rich history already in our communities and in the diaspora of forming these types of, collectives, basically to make sure that we're supporting each other in times of need. So I looked at that, I realized, well, we have a lot of families in our community. We have a lot of teachers and folks connected in education that want to support. And we see a lot of solidarity from people that want to support us in terms of business owners that are also working with the same community that we're talking about. So it just became a point of, all right, well, let's talk to people. Let's see how we can formulate this. And then picking the brain of some of my friends that were either mutual aid founders or co-leaders or co-organizers to say, okay, well, how have you structured this? Let me get some feedback from you on what you think is a great idea. And, that's more or less the history of our particular group, is that I met some great organizers in this time frame between March and April that had also been, and it's almost exclusively women of color at the onset. There was a set of organizers in Uptown Manhattan that they organized an Uptown Bronx mutual aid group with a couple other folks from like the Washington Heights Uptown area and the South Bronx. There was an organizer dealing in the Northern Bronx, but sort of bringing together mutual aid initiatives throughout, kind of collecting different people and volunteers throughout the Bronx. So I just want to give a shout out because there was a lot of inspiration to be had from other co-leaders. And near the end of April, I was invited by one of those leaders, the Eastern Bronx Mutual Aid leader, someone named Amanda Farias, to join in this greater collective of mutual aid, leaders and organizers that were communicating throughout the city. And that was, for me, hugely impactful, and having a sense of, okay, for the logistics, how are you operating? For the food sourcing, how are you operating? For volunteer networks and recruitment, and how are we operating in certain ways to keep this equitable, to keep a centered mindset of solidarity as we're doing this. And so that's, I guess, sort of the history of looking at it from the onset of the pandemic to now.
Thank you, Ariadna, for sharing the background. The solidarity and the community, just togetherness that we've seen throughout this pandemic has been so inspiring and so necessary for our communities. We know that the need is there, and the fact that teachers and educators such as yourself are stepping up to, the plate, aside from everything else you're doing in life with remote learning and everything. I'm curious, how are you balancing both of these acts, mutual aid work and also helping your students and your kids out during the pandemic remotely?
I'm going to tell you right now, like this is my favorite, my planner, right? It gets planned down sometimes to the hour, and there are a lot of meetings, right? So I teach remote students in a number of content areas. I teach, again, multilingual education, computer science and programming, science, Spanish. I've also been an ESL teacher. So there's a lot to balance just on the remote learning end and making sure that there's equitable access for all our kids. I know that I jumped in knee deep into advocating for our students to have Wi-Fi access and device access in the spring. There was a huge equity issue. And so that's, part of, again, where this idea of like mutual aid and collaboration goes, is you hopefully know somebody in some world that can connect you in. It could be a community member, it could be a nonprofit, it could be anybody. But I think that that's part of what we thought about, is how do we widen this web of community level folks, resources, etc. Because there are gaps to fill. And unfortunately, if we just wait for higher levels of officials to solve it for us, we could be kept waiting for a while. And so that, again, just framing it from the educator's mindset and the mindset of, being a person in the community, also being a parent, I am not one to wait for someone else to resolve problems for me. I've often spoken to my kids about the importance of personal advocacy. Like, if you need something, if you want something, you need to communicate that, you need to advocate for it, you need to talk about it, and materialize that in the world with the connections that you make, because community is the heart of so much problem solving, and it's frustrating when you're looking outside waiting for a resolution for your basic needs to be met. So, that is one thing that I've spoken a lot to my kids about, is the history of movements of organizing throughout, especially Latin America and the Spanish-speaking world and within the United States, and how are we now using things like technology to be able to connect with each other, especially during a pandemic, so that we can get access to resources, so that we can share with other members of our community.
Absolutely. Thank you. Ariadna, you did share that you have been personally affected by food insecurity in the past. You shared this on the South Bronx Mutual Aid page. Can you just tell us a little bit about your experience and why this work is so important and personal to you today?
Sure, absolutely. So, for background, my mother is an immigrant from Mexico. And when I was growing up, unfortunately, my father passed away when I was 14 years old. And my father was the primary income earner in our family. So, the period after he passed was particularly challenging. My mother had an education in Latin America. And unfortunately, in the area where we grew up, they were not willing to recognize her credentials. So it severely limited her earning capacity, that even though my mother is actually fluent in 4 languages, she was not permitted to have her degrees be honored where we grew up. And as a result, she could access wage type of, like hourly wage type of work, but could not access other things. And it was devastating, right? It was devastating to the financial situation of our family. And as I've, explained in both English and Spanish on some of the platforms I've talked about, there was a period of time where in our family, we did not have food security. And it wasn't a brief period of time. It was the period of time when I was in school. And, I have a younger sister, so she was young at the time. And it extended even when I was into college. I was responsible for what the university did not make up for in financial aid. And as a result, I couldn't afford the dining contracts after a certain point in time. So I would have periods of time, especially if even the dining halls weren't open, where an entire week I might subsist on a loaf of sandwich bread, some peanut butter, some lemonade, and I would just have to measure it out to make it during that period of time. So when you live so many years like that, when you're marked by food insecurity for the formative years of your life and your formative years as a young adult, it absolutely is not something that you forget, right? I think that it's something that for me has always been a priority when I've spoken with student families. And again, this is even well before the pandemic. We would have families at different periods of time that would be facing food insecurity. So we would have, different mechanisms to try to fundraise, can food, etc. Or just me personally, I would show up bags of groceries because that's a basic need. And I think that, again, that's absolutely marked me in this work and thinking about having been on the other side of this, right? Having dealt with food insecurity and trying to go wherever I could to get food and to get my needs met. There's also the dignity issue. I think that has also marked the pathway that I've approached this, is that it's really hard as a young person to stand in a lengthy line for a pantry, or potentially to go somewhere where they may run out of what they have available to share with you. It's very scary, especially as a kid, to think that you may not have a meal, or you may need to wait for hours and hours with whatever the weather may be, to be able to access something that's a basic need. So the mechanism that we've used within the mutual aid has been direct delivery, right, to the families that are requesting support in mutual aid, and also to fill the community fridges that we've seen come up in the South Bronx and in the Eastern Bronx. So those community fridges are open 24/7. They're accessible at any point in time. And again, the model of solidarity, people are sharing, people are giving what they have, right? So there's this, I think, a wonderful model again of community engagement in taking care of mutual needs, that also allows the dignity of, like, it's like shopping. You're just getting something out of a fridge, getting something out of, a publicly available space that's not limited to anybody in particular.
Absolutely. For the community and by the community. That's
exactly
the motto everywhere with mutual aid efforts and the community fridge that we just got on 141st and St. Anne's over here in the...
That's the Mud Haven fridge. Yeah.
We love it. We love it.
We are super happy to support that fridge. That's very close to the school community that I've been working in for several years now. And yeah, big fan.
Before we go, Ariadna, what do families need in the South Bronx the most? What are they requesting from South Bronx Mutual Aid? And how can you sustain this work, continue to sustain with this work? What do you need at this time? Do you need volunteers or a helping hand? How are things going?
Sure. It's a little bit of everything that you've mentioned. We consistently are getting requests for grocery deliveries. We have kind of a standard set of food staples that tends to be included in most of our deliveries. And that would include what you would expect, right? So grains, some proteins, dairy. when possible, proteins that include eggs or cheeses as well, beans, rice, right? So this oil, the types of things that you would anticipate most dietary restrictions would allow for. And we do have families that uniquely will tell us, hey, we're halal, or, we're vegetarian, or whatever those, special conditions might be. And we do our best to meet them. We always need staples. Staples last a long time. So canned foods, will happily take those donations. And you'll see a contact point. I'm going to add it into our social media if folks want to be able to donate specifically food. We also get requests for PPE, mostly masks. So masks are something that we redistribute in the community. We also have requests that we get occasionally for infant supplies. So diapers, wipes, and certainly things that sanitize. Finally, I'd say the volunteer is the big one, that we take volunteers, and definitely volunteers that are multilingual. So volunteers that speak Spanish, volunteers that speak Arabic, volunteers that speak West African languages and other languages that are reflected in our community, volunteers that speak indigenous languages, right? We have a community that speaks Nahuatl, we have a community that is Mixteco. So again, multilingual volunteers are amazing because they help us reach all the folks that we want to make sure that we're supporting with dignity and solidarity.
Let's say someone is tuning in. How can they, support you and reach out in order to volunteer, or even a family that needs, this assistance right now? How can people reach out to South Bronx Mutual Aid?
Absolutely. So we have an Instagram page. It's at South Bronx Mutual Aid. And so there's already a form there to request support. There's also, if folks want to donate, their donations go directly to assist the families with the purchases that I mentioned of the groceries and supplies that we purchase. I'm also going to be adding a link for volunteers if they want to sign up to volunteer, because right now we're trying to parse through the different skill sets and the different abilities of some of our volunteers. So for example, language, do they have access to a car? Are there particular zip codes that they're willing to serve? Because we are trying to keep people as much as possible to the asks that are going to be reasonable for them. But again, you don't have to be of a specific anything to volunteer with us. We are happy to take everyone that is available and willing to do this work. Very excited to have more volunteers.
Thank you so much, Ariadna, for your time today and for your work here in the South Bronx through South Bronx Mutual Aid.
Awesome. Thank you again.
Again, folks, for more information and to see how you can support their mutual aid efforts, you can follow at South Bronx Mutual Aid on social media. Also visit their link in their bio, their link tree at linktr.South Bronx Mutual Aid to see a list of COVID-19 community resources. They have an extensive list of resources and information for you in that list. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Take care.